Next up, we have Mary Lesser. She's a dietitian providing comprehensive care for inpatient and outpatient and leads the Bay Area's only pediatric sports nutrition program. She earned her bachelor's degree from UC Davis and her master's in nutrition from Tufts University. And then she completed her dietetic internship at Tufts and then went back to UC Davis for her doctorate in nutritional biology. So welcome, Dr. Mary Lesser.
All right, good morning, everyone. Thank you for having me here today. I am super excited to speak, and I think it's a great transition. All of the information on REDS is something that's obviously very prevalent in my clinic, and the team here is amazing with the referrals to nutrition to rule out that energy deficiency part of it, where I get to do my full jump-in analysis. And so today's talk is actually going to be hopefully somewhat generalized, although I think we all know here that when we're working with athletes, patients, or what have you, it is really an individualized approach that we're taking. So hopefully with the information today, you can see that you can take the general and apply it into your own individual clinics or patients or whoever clients you might be working on. So my name is Mary Lesser. I am a sports nutrition dietitian here at Children's. I see athletes not only in Oakland, where technically my home base is, I actually see all athletes throughout the Bay Area. And oftentimes I do get referrals from different parts of the state, and which is pretty cool. I've actually worked with athletes from my hometown in Rockland. But in addition to my role at Children's, I'm a professor at UC Berkeley, so I do work with, not in the sports, not at Cal Athletics, but I work very closely with those dietitians and some of the research that they're doing up with their athletes too. So it's also kind of cool sometimes to have the athletes that I've worked with in my clinic who've gone on to college, particularly at Cal, and I know that they're working with those dietitians there as well. So nice continuum. So I have no conflicts of interest to disclose today, and our objectives for today's talk is that I really would love you all to take away, how to recognize the importance of nutrition intake as a whole, thinking about patterns and behaviors specific to the pediatric athlete, including in and outside of activity. So I know a lot of times when we're speaking about sports and athletics, we're thinking about how to fuel the athletics. And the unique thing about pediatrics is that we need to think about what's going on throughout the day, because there are other activities too that we need to keep in mind. And then the second objective for today is for me to propose some strategies and tips for young athletes with and without special dietary and nutrition needs in order to optimize their health as well as their performance in sport. So we're going to cover some basics around what my approach is in terms of how we assess an athlete in terms of their nutrition, how to generally set goals for sports and our sports athletic goals for our young athletes, propose the strategies for helping to meet those nutrition goals. I know Dr. Center talked about how do we increase energy needs for REDS patients. It is very difficult, and sometimes it can be a very general, here's what we can do, and then sometimes it's okay, I have 3 other kids that are in athletics, what else can I do to also make sure that I'm meeting their needs as well? So it can be a deep dive. And then just to provide some take-home messages. So first up is assessing the athlete's nutrition. So there are 4 different components of this that are always consistent in terms of my assessment of my athletes as well as their sport. So I'm looking at dietary intake patterns inside and outside of the sport. And then I'm going to be taking a look at diet quality. And this is not just are they eating processed or unprocessed foods. This is looking at the whole picture of what they're eating, when they're eating, what types of foods, so I can get a picture of where their energy is coming from and if their micronutrients are being met as well. And then supplement use. This does come up, and not just in the terms of are they taking a vitamin or mineral supplement, but sometimes I do get some specific questions around, should I be taking caffeine supplements? Should I be taking creatine? I watched this person on a podcast, or listen to this person on a podcast, or this person on a YouTube, and they say I should be eating a raw diet but also taking these supplements. So that comes up as well and something to capture. All right, so dietary intake pattern outside of the sport. This is a lot of the questions that probably, if you are asking these in your own practice, no matter what field of healthcare that you're providing, is looking at the whole picture. When and where is eating occurring? Is it just in the house? Is it at school? Is it on the field? I have some athletes that are having to go into the city if they are doing intensive ballet. Are they eating on BART? Are they jumping into a carpool? Where is this eating taking place? And what's the pattern like? Are they packing their food? Are they picking up something quick? How much of the food is actually being consumed? This is a tough one. This is a tough one for dietitians as well, because we get a lot of like, well, I think I eat like half of this. Okay, well, what was the original quantity to begin with that you were eating, right? I usually take a couple bites and then I have to run onto the field. Okay, well, what is a couple bites? Like half a granola bar, like 2 small bites. So again, like really trying to get that snapshot. The types of foods being consumed, right? So is this a family that is on the go all the time? And so like they're like, we have to default to prepackaged food. So here are the things we get at Costco, here are the things we get at Target, Walmart, what have you. Or is this a family where like they're like, we make everything on Sunday night, we prepackage, have it out for the weekend? Or is it's kind of a mess every day? It just depends on what the schedule is, and we're just tackling it as we come, right? So what types of foods are being consumed, when, how much? And then one other big one that I have to come up with or tackle in with my athletes is not only how is their energy level through their sport, because I will say 99% of the time, most athletes say, I feel great. I have so much energy. Like, I feel like I can finish all of my practices. I felt great after my game, what have you. And then I start to peel back and say, like, okay, well, what about, what about after your morning break? I was a little tired. Like, I felt like I was a little like lethargic, or like, there's certain classes that I fall asleep at. And so then it's kind of digging like, well, is that a boring subject because we're all not as interested in it? Or is it that like, it's 1 or 2 o'clock, you didn't really get a chance to have something in the morning, you were up late staying up doing homework because you had a late practice, and that your lunch was only something small because you wanted to spend time with your friends, those are all very important things and have to come up. So again, taking a look at those energy levels throughout the day, not just at the athletics. All right, thinking about in and around your actual athletics. Are these athletes eating anything before they're going out to practice or train? To be honest, it's like 50-50. I have some athletes that are like, oh yeah, I definitely always make sure I have a snack. I have other athletes that are like, I am running from class to practice to get home, change. I have 30 minutes to do homework to go to the next thing. So really trying to take in like how much fuel is on board before they're going into their activity. Also, what is the activity? Because obviously if you're going in for a 2-hour practice as a soccer player where you're on the field moving for greater than 60 to 90 minutes of high intensity, there's gonna be more need for that versus maybe a recreational athlete that has practiced for 30 minutes and they don't necessarily need as much because they might be working on strength training, so it's a different type of fueling. Typically the window that's recommended for eating before for pre-fueling activities is 1 to 4 hours. Oftentimes that is capturing not only do they have a snack, but did they have lunch as well. And sometimes I see the combination effect of like, I don't have time to have a snack, but I'll have a larger lunch and then I'll have something small for a snack. And that can all fit into that as well. Again, the type and quantity of the food consumed, because sometimes I get the complaints of like, well, I don't usually eat something because I have a stomach ache. Okay, well, what were you eating before and why might that be giving you a stomach ache? Was it a super heavy, like dense meal, like that was too large, knowing that you were going out to run? Or was it something that the makeup was a little too much, maybe too much fiber, protein, fat, or what have you, so it was taking longer for your body to digest because you were eating it 30 minutes before? And then always fluids. This is a hard one. Particularly I find for my high school athletes is making sure that not only do they have the water bottle, but they're actually drinking the water bottle. It's been a little bit easier since COVID when like water bottles were not okay, eating in class or drinking in class was not okay. So now it seems to be a little bit more flexible. So sometimes it's just finding out like if you're drinking, when you're drinking, and how much. And the types of fluids too. Unfortunately, I get athletes that are like, I don't drink anything all day, and then I slam 2 water bottles before practice, but I don't feel very good. And so it's like, okay, great. I love that you're recognizing that fluids are important, but like, how can we break this up throughout the day so that you're not going into practice feeling slushy? We don't like that. Also, I do get a lot of questions about what fluids are appropriate, especially as some of my athletes are getting into that transitioning to college or out on their own. Like, they do enjoy, beverages that have caffeine. Is that okay? Not okay? Is that dehydrating? How much does that, impact their dehydration status? So there's a lot of conversations around that as well, and the use for them. And then eating post-workout and events. So the timing, I get a lot about like, do I need to drink that chocolate milk as soon as I finish getting off the court for basketball practice? Like, or is it okay that I have dinner within an hour of being home? And so we go through that as well of like, when do you eat after your workouts and what types of foods you might be eating and how much? And I do take a look at, kind of the snapshot of, our macronutrients that we would want to have, macro being our energy providing nutrients, which we'll go into in a few slides about carbohydrates, proteins, and fats that are going to give us our energy. And then again, fluids, especially depending on the type of workout it was. Was it a really hot day? Do we have our soccer players or lacrosse players out here on this side of the tunnel where it's a lot more, hot, there's a lot of sweating. I'm personally a heavy sweater, I'm a runner, and have experienced dehydration in a way that I would not want anybody to experience, even when I was trying to hydrate properly. So all the things to practice and keep in mind. Another part of the nutrition assessment that comes up is injuries. And again, this is a general talk, so I'm kind of bringing up the bigger things that come up at my clinic. I do get quite a lot of referrals for athletes that have been injured. Maybe they've just started to return to sport. Maybe they haven't fully returned to sport, but really thinking about like where they're at and how to balance their nutrition, because nutrition is very important in the healing process, as well as hopefully to help prevent further injury. All right, so in general, kind of what happens as a reminder in the stages of healing, and again, this is a very broken down approach, is that you have immediately that inflammatory period, right? There's an injury, you've got all of our mediators, our body switching into like, let's pro-inflammation, we want to get to healing and such. Nutrition doesn't necessarily have a huge role in this first stage and part of the healing process, but there is a switch in how nutrients are used because we are prioritizing healing. So this is where you would see like the prioritizations of proteins being used to go into those healing mediators and such. So there is some changes in nutritional status, but not really in the sense of that we need to do any full nutrition intervention. It's when we start to get into the proliferation as well as the maturation stage that nutrition really comes into play, because we need to help support that healing process and to recover from that first inflammation. And again, this is also in the context of what the injury was and the time it's going to take for that injury to heal. So some injuries might be twisted ankle or something, and like, yes, it is something that does take them out of their sport, but it might not take as long to heal that as like a pretty severe like fracture, or even if they've had to have like a major surgery like an ACL tear or something where you see actual like decompensation of the muscle, and that there's going to be more involvement in that. All right, so I bring this up because when I get athletes, I get them to come in to work with me at all stages of healing. Sometimes it's something that happens right afterwards. Sometimes it's, almost a year out of their surgery and they're still having some lingering problems and they're really just trying to maximize. So I have to take into consideration what they're doing, what the level of activity, and then as well as what I can help with supporting in terms of recommendations for their nutrition. Other considerations that most often come up in my clinic that I am assessing for. Food allergies are a big one. Food allergies not only in the athlete themselves, but sometimes if there's food allergies in the home, so certain foods and such need to be avoided, and how to work around building a dietary pattern that would help out with meeting needs still. Food intolerances, right? Lactose intolerance, certain wheat or gluten intolerances, and so we're having to avoid certain foods again to not trigger any flares. These are big, especially for someone maybe who's coming in with celiac disease and they've been hearing like, I need to have my carbohydrates, but most of my food that I'm being recommended has wheat in it. That's a carbohydrate-rich foods. What can I do? I also bring this up because sometimes I have athletes that come in that are following specific diets for medical reasons, like they have Crohn's or ulcerative colitis, and they need to follow a specific diet, like the specific carbohydrate diet, or they're on exclusive enteral nutrition, but yet they're still an avid athlete. So it's again meeting those nutrition needs while also supporting what that medical nutrition therapy treatment would be for their medical condition. Vegetarian and vegan athletes, for sure. And I get a lot of, when I say vegetarian, vegan, it kind of runs the spectrum. It could be a vegetarian that's a lacto-ovo, only consuming milk and eggs, some that are consuming no meat or animal products at all. Again, all find a support in youth athletics. It's making sure that we're meeting all nutrition needs, though, when we know that some of those kind of bigger food sources that we're more commonly we know or hear or seen or recommended are not going to be what we can recommend for these athletes. I will say it does help that I'm married to a vegetarian athlete, and so I have a lot of extra recipe ideas and such that I usually am sharing of like, I've got this for you. He's a endurance cyclist, so we have a lot of recipes. All right, so in thinking about the assessment, really it's a lot of information collecting at first. I can go back here. A lot of information collecting, so then I can start to build the picture around what does this athlete need based on their sport, based on their medical history, based on their GI history, based on what the referral was for, based on where they're at in their development. Because that's the key thing with pediatrics, which for anybody who I believe in this audience is working with, is that there's a lot of that extra special growth and development that's going on, that on top of whatever medically might be going on with your athlete, you are still trying to support that normal development that we would expect and hope for in these athletes. All right, so with all that information, I take all of that and piece it together. I do take a very detailed diet record from these athletes, and I run it through different programs to actually get a diet recall to give me an estimate of how much energy they're getting. And then I break down of where that energy is coming from, because again, depending on the sport, the energy you need to fuel that sport is slightly different. I also want to know, are they meeting their micronutrients, their vitamin and mineral needs, particularly if they are presenting with fractures, they're transitioning into that really big like bone growth phase, that we want to make sure that when they have that jump up in actual recommended need, that they're meeting that. The biggest one that I see is calcium and vitamin D. Calcium being when we transition up to, if I remember correctly, I think it's like 12, we jump up to 1,300 milligrams per day. And when I break that down to my athletes of what does that look like for food, because that's the other thing, we don't eat numbers, we don't eat nutrients, we eat food. That would be like 5 glasses of milk, like, because each 8-ounce glass of milk is 300 milligrams. Now granted, there are way other food sources besides milk, and we talk about that, especially because I have a lot of non-milk drinkers, but just to give them that perspective of like how we would translate that to like the food and what they could do. All right, so setting the goals, again, is going to be based off of that assessment. And some of these are obviously me-driven because I'm the dietitian, but a lot of them are actually really driven through the athlete and the family themselves. One of the first questions I ask is, why are you here and what do you hope to get out of this appointment with me? What can I help you with? And what's important to you? We do a lot of talk, actually, before I even get to the nutrition, about the sport themselves. I just am interested in what the athlete wants to know, what they want to talk about, why they're interested in their sport, how long they've been a part of their sport, and like what they really want to do with their nutrition, because that helps me identify their motivation and helps me to do with goal setting with these athletes. So general goals that come up, and again, individualized depending on who you're working with, are identifying what the common challenges and concerns to that athlete as well as their sport is. Again, a ballerina who is intensive doing point as well as multiple days of training, and they're traveling into the city because they're part of the San Francisco Ballet, is very different than somebody who is playing, let's say, competitive soccer, right? 2 different needs, although they could be playing competitive soccer both for high school as well as a competitive club team. But again, very different needs, very different energy availability, right? Also then meeting nutrient and energy needs, so separate energy coming from our energy providing nutrients, carbohydrates, protein, and fat, and the actual nutrient needs. And so there are specific recommendations, and that depends on the athlete themselves, right? So we have different age groups that have different needs based on what their development would be. We have different needs depending on the type of activity, as well as if there's any sort of unique needs based on medical condition or a specific injury. Right, because we really want to make sure that we're meeting these needs with a variety of foods and fluids to, again, support that general health and development of our athletes. And then encouraging intake of food items with those nutrients to optimize performance, prevention, or recovery of injury. So really taking a look at if there are any, let's say, holes, or if there is areas of improvement. Most of the times it's areas of improvement. Most all athletes are eating, and they're eating okay, but there are ways that we can kind of tweak and help them kind of really enhance and meet those goals a little bit more. And then promoting age-appropriate independence and ownership of athlete sports nutrition goals, right? So this is a big one, especially for my teenage athletes that are, again, looking to transition out to college. Like, we want them to take ownership of this because that's also going to get their buy-in, right? But also because they're starting to think about, like, if I'm going to continue athletics, either at the collegiate level or competitive, even if it's just intramural sports and you're having a good time, or I'm going to keep with my club team, they're going to be doing this out on their own more often than not. So how can we get them more involved? Is it giving mom and dad what the list of foods they want to try this week? Is it having them kind of plan out when they need a pre-feeling that they have to pack it versus it'll be available to them because their team provides it for them, right? Getting an idea of if it's going to be a really long day because we have projects due in school or there's extracurricular activities with church and other clubs, like, planning out when you might be able to eat, right? They can be very basic or it can be very intense. Sometimes it's also just somebody who's an extremely picky eater. This happens more often than not with my younger athletes, but I'm not eating enough vegetables. My mom and dad think I need to eat more vegetables because I know they're important for me to be strong for my basketball, but I don't like them. So sometimes it's even like setting goals and having them pick out how many bites they're gonna have of a new food each week. So it can run the gamut depending what the need is. So strategies to meet sports nutrition goals. There are a lot of them out there. And again, it's very unique to the athlete themselves. But kind of how I approach it is I break it down first about the biggies, energy and nutrient needs, and where we can find those. So this is always, I tell the athletes, this is not supposed to be a scary slide. This is supposed to be just a very general kind of where you get your energy from and why is this important. I said this is kind of the nerdy Mary slide, right? And so you can see here that there are only 3 nutrients, not foods, but nutrients that we can get energy from. And that's why you hear, especially your older athletes might be like, should I be following my macros? And you're like, do you know what macros are? And what that means. And so macros referring to macronutrients are those nutrients we need the most of or the largest amount in what we're eating. And so macronutrients, again, that are gonna provide us energy are carbohydrates, protein, and food. So they all provide energy. Vitamins and minerals, although very important in a different way, not for energy purposes. They're for a different purpose. So this is where we get our energy. So I have them kind of practice, how do you identify foods that have energy in them? Hey, first of all, how do you then identify foods that have that might be more carbohydrate rich versus protein rich versus fat rich? When would we, eat more or less of these foods around your different activities? All right, so going through that, and this works well one-on-one in clinic, I have a more limited amount of time, but when I do team talks or I'm working with clubs, I put these up and have the athletes engage in telling me which foods that they eat, which foods they think of that first comes to mind, so that they can start to practice. It's the same kind of similar approach for our inpatient that may have been just recently diagnosed with type 1 diabetes, and they're identifying foods that might raise or lower their blood sugar, identifying the foods because that's what they're going to eat and that's what they make their choices on. So carbohydrate-rich foods, I think for many of us in this audience, we know, but things that come up often that athletes don't think about is fruit. The most common one is, grains. Everyone's like grains, pasta, breads, but fruit is a big one that people forget about. It's also the most normally most acceptable because it tastes good. Lactose, so the milk, sugar, and dairy you can get carbohydrate-rich sources from, are starchy vegetables. We talk about, different times of year, more produce is going to be available. So right now in the winter months, coming into the spring, wrapping up those starchy winter veggies, beans, legumes. And then we talk about things like, well, what about honey? Can we get them from other sources that might be considered not healthy? And we talk about all of the different types of foods and where they might be getting them in their diet. Okay. This is the same for protein-rich foods, but I start to highlight out that you can get a lot of 2-for-1s or 3-for-1s here. So you don't need to eat just foods for carbohydrate-rich intake, just foods for protein, or just foods for fat. That you can really take a look at the whole diet to say oh, hey, that glass of milk that you're having or that apple and peanut butter has protein, carbohydrates, and fat in it. You're hitting all three of your macronutrients there. So again, they start to see the bigger picture of like, oh, if I eat a variety of different foods, I'm meeting those energy needs, and then we'll dive into the vitamins and minerals. So anyhow, so these are some of the visuals that I might use when discussing those. And then finally, other strategies that come up, fluids, again, I mentioned this earlier, is a big one. I get a lot of questions around, my team gives out sports drinks, should I have it, should I not? What's the type of sports drink? When is one appropriate, when is one not? What about other ideas for foods and recipes? I think probably by far this is the biggest question I get is, we're out of ideas. What ideas do you have? Do you have recipes? Do you have cookbooks? Do you just have an idea for quick snacks that are okay? Is one granola bar the same as another? Should I be doing a protein bar? What have you? So we talk a lot about different ideas for what might be appropriate for that type of athletics, what's going on in terms of the day and such. In the bag, suggestions are a big one, especially with helping to support our athletes in their individual ownership. What can they pack to put in their bag? Especially if like they're leaving the house at 7:30 and they have their sports bag, their backpack, what have you. There are obviously some foods that handle a lot better than others. PB&J, amazing food, does not handle well if the jelly gets all over the place. Bananas, also great, but always take up, like everything tastes and smells like banana when it's all together. So we talk about just some tips and tricks for that as well. And then on the road, a lot of our athletes have outside competitions. They are, traveling, sometimes far, sometimes near. How to pre-plan to still be able to meet their sports nutrition goals when they are on the road, especially if some of the food options are limited, or limited in the fact that it's not foods that they are used to eating. So with that being said, that wraps up my talk today. So hopefully when leaving, my take-home messages for you all is that it's really important to assess the diet and dietary patterns as a whole, not just around the sport itself, but looking at the whole picture of the day and how that might impact their nutrition as well as their need for performance and healing. Aiming to have your athlete balance their energy consumption with their physical activity level. Encouraging the athlete to consume nutrient-rich items to promote general health and support any recovery and healing. And finally, really utilizing that individual approach for athletes that have specific nutrition needs. And then that being said, I think I have a couple minutes if people have questions, or are we waiting? What was that? Panel. That's what I thought. Okay, sorry. So I think I might be a few minutes early. So thank you again for letting me come and speak today, and I look forward to joining you all for the panel.
Thank you, Dr. Lesser.